Alrighty, well, we'll go ahead and get started here as folks continue to trickle in. Good afternoon again, everyone. Thank you so much for joining us. My name is Madison Gaskill, and it is my pleasure to welcome you on behalf of the Ohio Program for Campus Safety and Mental Health for today's webinar, The Essential Role of Sleep in College Mental Health. I do have a few announcements before we get started. CME and CEU credits are available for today's session. The activity code will be 16 Gs. That's 16 GEES. This code will expire on Friday, November 8th at noon, so 24 hours from now. So please be on the lookout for information in the chat on how to receive those CME and CEU credits. You can always find additional details on our upcoming events and programming on our websites and social medias. So please feel free to reach out there or connect with us there for more opportunities. And throughout today's presentation, we encourage you to post your questions or comments in the Q&A feature. Dr. Prichard will monitor that and look at them throughout the presentation and maybe have a few minutes left at the end as well. And we really encourage you to engage in today's discussion. And finally, this webinar will be recorded and available on our YouTube channel for viewing later. And without further ado, I will pass it over to Annalise to introduce today's presenter.
Great, thanks, Maddie. We are so excited to have Dr. Roxanne Prichard here with us today. She is a professor of psychology and neuroscience at the University of St. Thomas in St. Paul, Minnesota. She received her BA in biopsychology with a minor in women's studies at Transylvania University in Lexington, Kentucky, and her PhD in neuroscience at the University of Wisconsin-Madison under the mentorship of Drs. Mary Behan and Ruth Benka. She is passionate about helping individuals live their best lives through better sleep. So I'm going to go ahead and pass it over to Dr. Roxanne Prichard so she can tell us more about living our best lives through better sleep.
All right. Thank you so much, Annalise and Madison. And thank you, everybody who's joining in today. So I'm going to share my slides. All right. Is that working? Think so? Excellent. So I just wanted to start with the reminder. And if we look at Maslow's hierarchy of needs, sleep is a physiological need at the very, very base of this. And I think of the basic needs that we have, food, water, air, shelter, sleep often gets kind of sidelined in a way where we don't think of it as biologically as critical as we need. So I often invite students, audience members, colleagues to think in their sort of cognitive chatterbox in their mind, what is taking up the most mental real estate in terms of in terms of Maslow's hierarchy of needs? Is it a dialogue that's I'm exhausted, I'm so tired, I need a coffee, I'm so tired, how can I get through this day? If that's the case, as it often is with students, it's a good sign that the brain is responding to a physiological need of sleep not being met. And when that physiological need isn't being met, the body changes in a way. The body activates the fight or flight system. The body puts sort of filters of anxiety and depression on our world to try to protect us. So one of the things I like to share with students is sleep is one of the easiest ways to turn your life around. Literally, the improvement can happen overnight. So I wanted to just start by acknowledging that for many, many students, and I know yesterday I spent a lot of hours in deep, hard conversation with students who are worried about their future, who are worried about policy changes that might be coming down the line, who are worried about changes in legislation that might make them much more vulnerable. So in this time, I wanted to just mention two things. I really appreciate Toni Morrison's call to kind of use expressive arts to think about how we can repair and connect. And I also wanted to highlight Tricia Hershey, who is the founder of the NAP Ministry. If you don't know who she is, please look her up. She is a womanist theologian, an artist, and a practitioner of rest. So her book, Rest is Resistance, Free Yourself from Grind Culture and Reclaim Your Life, it is such a powerful piece. I know many of us probably in this room are doing a disproportionate amount of emotional labor and probably actual labor as well. And we have to center rest in ourselves. So I can give you a lot of facts here, and I will, about the connection between sleep and mental health. But to feel that in the still small voice in your soul, reading this book and going through her Instagram pages would might be a lot more effective than anything I have to say today. So I just wanted to offer that as prelude and praise for the work of Tricia Hershey. So our modern lifestyle is one that creates a culture of what we call somnorexia, which is the ability to have sleep, but choosing not to do it. And what I mean by that is that we are in an environment where we have external stimuli all the time. Just looking at kind of the light pollution um, over the United States, we have signals from our phones, from our to-do lists, from our media sources that ask us to be responding 24/7. And that's a major shift in how we function. Um, as a society, we get 20% less sleep than our ancestors only 100 years ago, right? 20% less sleep. It was normal to have 10 hours in bed every night. And if that was what was normal, it didn't matter if you were up for an hour in the middle of the night, as many people are around 2 or 3 a.m. And in fact, there's references to first sleep and second sleep. But if you have a 10-hour period to get your sleep done, that's not as stressful as allowing like this short window from when you go to bed exhausted to when the alarm clock wakes you up at some arbitrary time in your sleep cycle. So we've also, just in the last 50 years, really decreased our time in bed. So now we are, I think, the only species that on purpose limits the amount of sleep we get through alarm clocks. And this is especially true for young adults. So this graph is a little busy. The main points I want to show you is on the x-axis here is the age. So as we go from youth, like 12-year-old, and this corresponds straight to puberty changes, that we get decrease in total sleep time, right? And this is showing kind of year by year, decade wise, each year. And these data are about 10 years old, and but the trend is still kind of going downward. Each year, fewer students are getting that minimum of 7 hours of sleep they need. And again, that's just the minimum. So we have both an age decline in total amount of sleep that is a combination of high schools starting way too early for students, sort of natural biological rhythms. Teens like to sleep in, and they've got the biology to prove it. And also each year, sort of the pressures to stay awake through smartphone usage, through maybe late practices, is increasing. So we're having what's called a sleep recession among teens. I know when I have asked students, when is the last time you've gone to bed when you felt tired and just slept until you were done sleeping, waking up naturally every night in a row for a week? Most students don't have an answer to that. They have normalized a sense of chronic exhaustion. And that chronic exhaustion, again, if you're a parent, this is something you know to be true. You will be familiar with this. So if you ask Google, why is my teen so? One of the first things you'll see, is it normal for my teen to be depressed, hate me, sleep all the time? And why is my teen so irritable, angry, tired, hungry, sleepy, aggressive, clingy, stubborn, sad? All these sort of negative emotions are amplified by sleep debt. And that's exactly what our college students are experiencing coming out of high school, sort of a prolonged exhaustion that adds a lens of negativity throughout their life. But what is interesting, both 10 years ago and currently, sleep isn't on radar as a health concern. So 10 years ago, this is the Mott's Children's Poll, the big concerns you had were obesity, drug abuse, smoking, bullying, stress. Those are the top five. Internet safety down number 9. Now, the most recent poll published, overuse of devices and screen time skyrocketed to number one, just kind of coming out of nowhere. And number two, social media. Number three, internet safety, right? So bullying has gone up, stress, anxiety has gone way up, but still, sleep isn't on there, even though it's intimately coupled with stress, anxiety, and also people's relationships with their screens and their connections. So that's something I really think mental health practitioners, anybody working with college students needs to kind of interrogate what can we do for digital well-being. This is something we've started working with an organization called Live More, Screen Less to do some motivational interviewing around screen use. And that has kind of been helpful because it's on a model of conversation with students, not sort of lecturing to, but learning more from and talking about together. So in my 20 years of teaching college students, I would say sleep concerns, stress, and anxiety have gone way up, and a lot of that is tied to devices. So I just want to add a little bit of kind of information about what we do. I saw in the chat there's a question about how pandemic has changed things. When things were on lockdown, actually teen sleep got quite a bit better because with the shift to remote learning, students didn't have to kind of transport to school, so they got more sleep that was more aligned with their biological clock. So our lab's research overview. We do a lot in the field of sleep. We see connections to health and wellness, everything from alcohol and drug use. And I want to kind of talk briefly about that because I know there are chemical dependency practitioners here on this call. So I think one of the biggest predictors of sobriety, one of the biggest predictors of managing recreational drugs, social drugs effectively is how well can people get to sleep without a sedative, how well people can stay awake throughout the day without a stimulant. So that's an important thing to consider. I know that now we're a state who's legalized recreational marijuana and daily users of cannabis has increased and sort of bypassed daily users of alcohol. And from our research, we know that more than half of cannabis users on campus are doing it just to get to sleep, right? Because they don't know how to get to sleep otherwise. We do a lot of work on how sleep is tied to academics and is one of the most powerful predictors of who is retained and what GPA they have. So that's tied into sort of understanding who thrives in college. And in fact, when we look at who does well academically, sleep adds such a big advantage. So when we're looking at straight A students, A, B average students, their sleep quality is so much better than C, D, and F students whose sleepiness is sort of off the charts. So I don't think it's a learning capacity issue. I think a lot of it is which students have the conditions in which they're able to sleep sufficiently and which do not, and what are those problems getting in the way of sleep. Very close to my heart is how to help and protect students' mental health and thinking about sleep as a modifier, right? So that's a variable that you can change. You can't change your genetics, you can't change your trauma, you can't change your family, but you can change your sleep. And this is something that I think health practitioners could really benefit from in asking deep questions about what's your sleep schedule like? What's getting in the way of your sleep? Do you feel safe when you go to bed at night? What are things that we could do to make this better? Working from there, I think, is helpful because a lot of students might not be willing to talk about anxiety, but they are willing to talk about sleep. So it's a low stigma conversation starter that really reflects mental health pretty powerfully. I do a lot of work with sleep and athletics and sleep as a predictor of athletic performance, and sleep is problematic for many athletes traveling coast to coast. But overall, I think sleep is one of the things that's most tied to well-being and retention. And one of the great things uh, that we've seen improvement in St. Thomas is we've integrated some pretty sophisticated sleep assessments and sleep education into our first year experience courses. So all students are getting information about sleep. We match the national average in students wanting to learn about sleep, but we're sort of doubling how much students say they receive that information. Again, it's a little like, I know it should be 100% because they all get it, but 40% remember. And that's showing up in better retention, better athletic performance, better grades. Yes, the slides are available if you're interested more in our research. I can send you links to this, or you have this as PDFs. So I mentioned that the good news is a lot of students want to learn about sleep. So this is from just learned how to say this, Achanacha. I think Achanacha. I've been saying ACHA and CHA, but those in the know have corrected me. If we're looking at what do students want to learn about in green and receive information, again, some of these are federally mandated, but the biggest mismatch by far is on sleep. So this is something where if you do a program on it, students are going to engage because they know they're struggling with sleep and they really want to figure out how to do it better. So just a quick outline for what we hope to do today. An overview of the science of sleep. Again, I'm a little biased because I am a neuroscientist by training who kind of recorded rat brains and sleep. So that's where my background is and sort of the point I start with. But the more I get into this work, the more I realize the concerns for sleep are much more sociological than biological for most students. But still, we have to remember that we are in bodies. We are just kind of 3-pound sack of goo floating in cerebrospinal fluid, and that is how we process and learn. And we are stuck with the sort of the physics of how this works. So sleep is a major part of our survival as a species, and we'll talk about why that is. Also talking about who does well, who sleeps well in college and who doesn't, and also talk about different kinds of assessments and sleep health promotions we can do. So just start, this is called a hypnogram of how we sleep. And medical schools don't actually give a lot of training in sleep. It's like a couple hours mandated. I don't think clinical psych really hits on sleep that much either. And I'm not sure if it's part of the social work curriculum for something that we spend a third of our lives doing, something that if we don't do can literally kill us. I would love to see a little bit more attention in medical and clinical training on sleep. So a hypnogram basically describes the processes of sleep. Light, all the sleep green. So I'll start by saying these different stages of sleep do different activities. I just got a note that my internet connection is unstable, so please chime in if there's an issue. All right. So deep sleep is the part of sleep when we are totally out of it, like fire alarms could go off and we wouldn't wake up. This is a part of sleep when our brain slows down to really, really low levels. And we've learned over the last 10 years that this part of the sleep is when our body produces a lot of restorative processes, increasing in hormone like human growth hormones, increasing in antibody production to sort of maximize our immune system. And in our brain cells literally shrink and our cerebrospinal fluid increases like 60%. So we get kind of this cleansing, literally a cleansing of metabolic waste products at the cellular level through what's called the lymphatic system. So this first half of sleep, critically important for brain repair, body restoration. And how can you not get deep sleep? What are the threats to deep sleep? That would be if you have too much caffeine in your system or other stimulants in your system. Again, half-life for caffeine can be 6 hours, 8 hours or more if you are pregnant, breastfeeding, perimenopausal, menopausal, or on oral contraceptives. So I'm just going to say women tend to have longer half-lives for caffeine than men. So if your caffeine levels are higher, that makes it harder to get deep sleep. Also, a lot of stimulant medication for ADHD, if it's taken too late in the day, can interfere with this deep sleep. Another important factor is if you do not feel safe, right? So I'm guessing many people on this webinar have the experience of being new parents and not not being able to sleep deeply because you're listening for your child's distress, that is going to make a less deep sleep. So if you're a college student who doesn't feel safe in their environment, that's going to sort of limit your ability to have deep, deep, delicious sleep and give you more of this light sleep, which is kind of like time is passing, but I don't really feel awake or asleep. REM sleep. Okay, love REM sleep. Now, it's pretty normal to have about 2 hours of your day when you are paralyzed and hallucinating. And that's what REM sleep is. Your body is totally paralyzed. You're not acting out your dreams, but your brain is wildly activating your limbic system, your memory circuits. It's going through all sorts of scenarios to figure out what in the world has happened today and how do I make sense of it and how do I better prepare for tomorrow. So this is something when I'm talking to students, I'd really, really try to make clear that sleep is not wasted time. Sleep is time that your brain is basically doing therapy on itself. Sleep is like you might study during the day, but the memory, the ability to put that into long-term storage when you are rewriting neural circuits, when you're myelinating neural connections, that is sleep dependent. Now, most of REM sleep happens in the last couple hours of the night. So if you just set your alarm clock for, this is somebody who goes to bed at 9, wakes up for 6, so let's shift that 2 hours. If you're setting your alarm clock for 7 and you're going to bed at 11 or 12, you are going to cut off a lot of your REM sleep. And that's going to be important because it's going to compromise your emotional state the next day. It's also going to be associated with decreased learning. Another threat to REM sleep, besides just waking up before you're done sleeping. And by the way, how do you know when you're done sleeping? You wake up naturally, right? The natural way to wake up is from REM sleep, which is a light sleep. If you wake up dreaming, you're aware of it and your body's kind of active. If you wake up like earlier in this deep sleep, you're going to feel like you got hit by a truck and you're not going to know how to process your day. That's called sleep inertia, when you've woken up in the wrong stage of sleep and you're like, I can't even. So we do some education about better ways to wake up for college students. And they are alarm clocks that will wake you up in REM sleep, not in deep sleep. And that is a more comfortable, less stressful way to wake up. All right, I know I'm talking a lot, but again, main points I want to make: deep sleep, body repair, brain repair, especially important for people with concussion, neural trauma, people trying to stay healthy with an immune system that's fully activated. Not fully activated, that'd be too much, but appropriately activated. And then REM sleep is really important for memory processing, emotional regulation. And that is impacted by not sleeping enough or by having too much depressives in your system. So here's where people who might use gummies, alcohol is worse, or prescription sleep medicines like Ambien, those are all going to depress REM sleep. So you might sleep the same amount of time or even longer, but it's not the same type of sleep because you're not getting that restorative REM practice. Okay. We have what's called Thirsty Thursday on our campus, where the partying starts on Thursday night and continues through the weekend. So if students were to do 3 nights in a row of alcohol with Thursday, Friday, Saturday, that's 3 nights of accumulated REM sleep reduction. So what happens in the first night of sobriety is you get something called REM rebound, which is this REM sleep desperately needing to happen, interrupts your deep sleep, and that's often in nightmare form. So anyway, I do some education around that with students, and that can be helpful also for students who are kind of struggling, or anybody struggling with chemical use. So to review, main purpose of dreams is to consolidate memories, process emotions, express desire, right? Often we have insight learning, sort of an idea when you wake up of, oh, this is what I should do in this decision making. This relationship is over, or I need more of this. I love that sort of joy come in the morning, the revelations that dreams can give us sometimes. And also, there's something called threat rehearsal, practice confronting potential dangers. So a lot of dream content is negative, and we don't have content to access to that content often. I have recurring dreams about tornadoes, which makes sense because I grew up in East Texas with a lot of tornadoes. So about once a month, even though I'm not in Tornado Alley anymore, I still need to get kids to safety dreams. We might have our own sort of recurring dream that your brain is like, okay, you don't do this often, but we need to make sure you're keeping yourself alive. So let's practice this sequence. And sometimes for people with nightmares who are worried about going to sleep, understanding that this is sort of an adaptive just in case can take some of the sting out of that. There's good evidence that for divorcing couples, people who dream about the divorce have better emotional regulation and better sort of sense of processing and closure 6 months later than the people who don't report dreaming on that. So, what controls when we sleep? Number one is how tired you are. So, if you're exhausted, you're going to fall asleep no matter what you're doing, even if you're driving. Nobody plans to like take a little nap between interstate exits, but it happens, right? So, if you're exhausted, you're going to fall asleep. Perhaps some of you are asleep now, and I know that's not me. That's just accumulated adenosine and hypnotoxins. When you're exhausted, your body's going to take sleep no matter what you're doing. So, might as well do it in a comfortable state. Second is circadian rhythm. So this is our like sleep need. After about 16 hours, we're kind of done with, and we shouldn't be pushing staying awake afterwards. Your circadian rhythm is in like 60% of your genes are under circadian rhythm, right? So we have our DNA, but what genes are expressed to kind of make more protein or make more of this neurotransmitter, those are all under a circadian cycle. So everything from when we're hungry, what's our body temperature, when our cells divide, are under this basic circadian rhythm. And it's best if this is lined up with our sleep need. So some of us are morning people. I'm a morning person. That coincides well with job availability. For those who are evening types, you're kind of often waking up way before your body is ready and asked to work at times when you are not emotionally or cognitively there yet. So I really think of this for first year students who are often stuck with 8 a.m. classes because the older students got to register first. And how hard that is, that first transition to college, asking to be woken up way too much. Way too early. I think of our college athletes who have to, get back from a game at 1 a.m. and then wake up at 6 to lift. It's hard working against your body's circadian rhythm. I think of our workforce, somewhere between 20 and 24% of whom are shift workers working against their circadian rhythm, and that's a hard thing. So two external factors that interfere with sleep. Number one is zeitgebers. Those are all the cues in our environment that tell us when to be awake, when to be asleep. The most powerful one of zeitgebers is light. So external light at night really messes with our sleep. It keeps us awake a lot longer, especially if that's short wavelength or blue light. So those blue light blocking glasses in the evening are really important for making sure we can express melatonin and get to sleep at night. Getting blue light exposure in the morning is also a very powerful way to wake up. So how do you get blue light exposure? You just walk outside. The sky is filled with it. So getting bright daylight during the day, staying away from bright light at night helps people sleep, but that's often not how students function. Drugs. So most of the psychoactive substances we use, either medicinally or recreationally, impact sleep in some way. So caffeine blocks our ability to know that we're tired. Alcohol can make us feel a little drowsier, but it in turn stops us from having good REM sleep. Nicotine just trashes sleep continuity. So a lot of the medicines and drugs impact sleep in some way. So often when we're trying to figure out how to support student sleep, I'm thinking of all four of these factors and how they can be optimized. So our circadian rhythm is timed to our buildup of sleep pressure. If you take a big long nap in the evening, you're not going to want to go to bed at night, right? If we're full of caffeine, like we have energy drink buses that just drive around our campus handing out free energy drinks. That's going to decrease your ability to sleep at night. I wanted to just remind people that this is biologically rooted. So I'm somebody who wakes up like 5 or 6 a.m. pretty naturally. I just wake up. I don't need an alarm clock, but I get sleepy around 9 or 10. So this is genetics. My body is increasing melatonin in the evening. So I know, okay, it's time for me to go to bed. All right. For college students, they often might not start this melatonin until midnight, and it'll still be produced at 9 a.m. when they might need to be in class. So here, I just want to reiterate to all those night owls out there, I see you, I acknowledge you, your sleep schedules are real and coded into your very DNA. And I think it's unfair that we're expecting you to be up and at 'em at 7 a.m. I wanted to show you what happens when you have an erratic circadian rhythm. So for me, it doesn't matter whether a student goes to bed at 9 p.m. or at 2 a.m. As long as it's consistent, that's best for their body. Here is a student, and we measure their sleep schedules in my sleep class and shared with permission. She gets up at 6 a.m. every night of the semester, usually is in bed by 10 p.m. She's a two-sport athlete. She's an ROTC. She's a commissioned Army officer and also a physician. But just that beautiful sleep rhythm, I almost never see in students. There were a couple days she stayed out late for spring training for softball and a birthday party, but otherwise, rock star sleep scheduler, like A plus on the sticker chart if she were a kiddo. This is much more typical of students where you have weekend, where you're sleeping in until 11, right? 11, 11, 11. And you might be taking long naps at 8 p.m. Sometimes you go to bed by 11 p.m., but sometimes it's not till 5 a.m., just depends. Let me show you what happens to the basic biological rhythm of temperature in that case. So here's my good sleeper, very tight sleep schedule. Her body temperature rises in the morning to wake her up. By the way, if you're cold, when you're waking up, your body's not done waking up. So as you get cold in the evening, that's a sign you should go to sleep. As you are falling asleep in the evening, your body temperature drops. So that's another indication that you should go to sleep. Here is that circadian rhythm of temperature with the student who had the all over the place circadian rhythm. Her body's basic 24-hour schedule of kind of hormonal control is all over the place. And that really resonated because a lot of other things made sense. Like this student didn't have a regular time for bowel movements, right? So the idea that there's regularity or morning constitutionals doesn't resonate for a lot of students. There's not a peak time because every day is different and it's hard for the body to know what to do with that information. So we'll see that when we analyze sleep, thinking about the schedule is as important, the schedule consistency is as important as the length of time. So I saw earlier in the chat, there was a question about how can we make sure students with ADHD medications know how much this impacts sleep? I would say often you can just ask them what happens when you take your medication later in the day. How does your body feel? What I suggest doing to a lot of students who are on that medication is setting their alarm clock an hour earlier, taking the stimulant medication, going back to sleep, and let that stimulant help wake them up. And hopefully it'll be out of their body a little earlier. And so they have an easier time going to sleep. I wanted to sort of just to give a quick biological explanation that we really are kind of different people at different times of day. I am usually helpful and attentive to my children in the morning and all till 7 p.m., at which point my mood really changes and my patience really changes. Luckily, my partner is kind of the opposite, where he's much better in the evening and sort of worthless in the morning. Sorry, if you're listening out there, but we know this to be true. Part of the reason is as our brain cycles through these different states of wakefulness, non-REM, REM sleep, we have completely different levels of serotonin, of dopamine, of acetylcholine, of GABA floating through our sort of synaptic uh, area. So we really are, I feel like, different emotional people based on neurochemical wake up at different times of day. So to sort of tell students, when do you feel your best? Put the hard things in your day at the point when you have the best capacity is liberating, right? I also wanted to kind of explain what happens when we don't get enough sleep. If we this is kind of correlating here. Lack of sleep mimics blood alcohol concentration. So if you just stay up 2 hours past your bedtime and do an exam of your vigilance, you'd be a beer or two in. If you stay up 21 hours without sleep, you are at the legal limit or you're performing as though you're illegally drunk on cognitive test of awareness and perception and reactivity. If you go a day without sleep, you're past the legal limit. So I explain to students, like, would you take 3 shots and write a paper? No. Would you stay up all night and write a paper? Yes. Paper is same quality if you stay up all night because your brain isn't performing as well because you have different brain chemistry. So how do we really do a good sort of an assessment of student sleep? If you just ask, hey, how are you sleeping? Students might say, well, because they're like, I can go to sleep whenever, right? So if you can just fall asleep whenever the situation arises, that's actually a sign of pretty severe sleep deprivation. And that's not a good sign, right? So when we're thinking about how can we assess student sleep, we have to think about 6 factors. Luckily, it makes a cute little rhyme, not rhyme, but are you sated, right? So thinking about regularity, how consistent is your sleep schedule? Satisfaction. A student with an undiagnosed sleep disorder might be sleeping, you know, 10 hours a day, but not feel like that sleep was restful. Are you able to stay alert for 14 hours in a row? How is the timing of your sleep? Are you making sure you're asleep when your body needs to be asleep based on your circadian rhythm? Efficiency is how much time you're waking up in the middle of the night, and duration is the length. All right. So we need all of these together when we're thinking about sleep. I don't know how I would sort of do an assessment of a student's emotional or cognitive state without also asking about sleep, because so many disturbances in sleep will just show up as anxiety, as inattentiveness, as depression, as panic. So we have to get a good baseline of sleep to understand anything else. So here is just some easier definitions. Same thing, the are you sated model, regularity, timing. And I have this in the slides so that you can refer back to. And this is recorded so you can go back and hear. But this is the official Are You Sated questionnaire by Bicey from Pittsburgh. So this is, I think, a much better way to ask, how are you sleeping, than a quick, hey, how much do you sleep at night? So I wanted to put that in action. I know I'm rushing a little bit, but I know I have want to get to Q&A as well. Consider the student who seems sleepy and distracted in class. You ask about his sleep. He shows his Apple Watch that his average is 7 hours and 13 minutes for the semester. But if you were to look at the regularity of it, this is what it looks like, right? So going to bed usually by 1:30, occasionally by 11. Sometimes there's 2 hours of sleep. Sometimes there's 12 hours of sleep. But what you're seeing here is a real lack of regularity, right? We might have many preconceived notions about why the student schedule is so irregular. In this case, he is in ROTC and has a lot of commitments that require overnight driving to set up camps in the woods for other cadets. And he also has an evening job, so it's hard for him to get the sleep he needs, and that definitely is showing up in his well-being. What about this student? Starts the semester fully engaged, prepared, upbeat, midterm grades approaches. Then we have a lot of attendance alerts, missing assignments, concerned about mental health, flies in, right? So here, and this is shared with permission from the student, we see that this student's sleep is really decreased for about a good 4 weeks here, right? So I used to go to bed by 11, sleep till 7, and now that shifted till 2 and waking up at 4 or 5 a.m. Anybody want to put in the comments what they think this might be? Any guesses? I'll pause for ideas in the chat. So this is Ramadan, right? So when you have to wake up early to help your family prepare the morning meal, when the evening fast is followed up with kind of culturally stimulating events, late night prayers, hookah smoke often, it is really hard to be a student and then wake up and do midterms and kind of make that happen. So I'm always worried when our students are having the hardest time in their semester, and that corresponds with Ramadan. So how are sleep, dreams, and mental health interconnected? This is a tarot card and one of my favorite images of sort of insomnia, and sort of the psychic price that pays. This is some research we did, one of the first articles that we published, just looking at the connection between poor sleep. This is the Pittsburgh Sleep Quality Index. You want your sleep to be under 5. So under 5 is good quality score. And this is PALMS, the profile of mood states. So this is negative moods like confusion, anger, depression, anxiety, sort of conglomerate. And we want sort of scores under 13, 14 here. So when we first did this, I was like, wow, that's a beautiful mathematical correlation. I usually don't see something like that in human data, where we're getting about a quarter of students' moods just explained by their sleep quality. That's a real powerful, there's like no antidepressant that gives you an effect that robust, right? No anti-anxiety regimen that's powerful. But we see that with sleep. With good quality sleep, you're really protected from negative mood states. One thing that happens is bad sleep increases feelings of loneliness in a way that might even be contagious. So this is what's considered a map of the cognitive social brain. We've got the limbic system, including the amygdala, areas that evaluate reward and risk, anterior cingulate cortex telling us where we should be paying attention. Basically this study asked people to stay up for 24 hours and then record interviews and do sort of social interactions. This is the same person after being awake for 24 hours straight, and he doesn't look like somebody you'd want to approach at a party. He doesn't look like somebody you'd want to have a casual conversation with. And this is kind of what that data found, that if you're sleep deprived and then you did a social task, people were literally not wanting to get close to you. If you recorded an interview, people thought of you as much lonelier and more isolated person as a result of that sleep deprivation. And this was matched, same person, well rested, same person missing that really important sleep. So it's considered contagious too, because the people interacting with those people felt lonelier having just interacted with somebody who's sleep deprived, because they're not getting back that social, like, hey, how are you? I'm engaging with you, right? So when you're exhausted, you keep your head down, you got your coffee here, you're walking around, you're not giving out pro-social signals that are, I'm here, I'm with you, I'm interested in you, I'm part of the same social community. Let's make something like interesting together, and I care about you. When you're exhausted, those aren't the kind of pro-social signals your body is giving out. So just to review, there's sort of a bidirectional link between emotions and sleep. When we are super stressed, and I've felt that this week, our emotional regulation and coping mechanisms are reduced, right? We're more of stress state, which adds up our vigilance and makes it harder to sleep. We are both cognitively more concerned, making it hard to sleep. We might have something called pre-sleep cognitive arousal, where the little inner voice in our head keeps spinning and spinning. How could this happen? How did this happen? What country am I living in, right? And then we also have the physiological emotional reactivity too, that's like, keep your body alert. You cannot get into deep sleep because your body is super hyper aroused now. What sleeping is able to do is sort of restore those emotional brain networks, do some of that information processing, and do important energy related processes so that we're able to sort of balance our emotions. So we only get like 2 hours of wakefulness to a 1 hour sleep ratio. If we try to kind of push beyond that, our cognitions break down. So when we're thinking about like how sleep is related to student health, this is a cluster analysis of loneliness, depression, anxiety, tobacco use, cannabis use, alcohol. We really see that insomnia, not being able to sleep well, is connected to so many other concerning college variables. So this is, again, a college data set with 80,000 students. And what we're seeing is insomnia is sort of a key player. When you're not sleeping well, the rest sort of falls apart as well. So that's one of the reasons why practitioners, if you have somebody who's both depressed and has bad sleep, anxious and has bad sleep, improving the sleep without even addressing the anxiousness or depression clinically improves both anxiety and depression. Not saying cured, but we're definitely moving up on some scales or down, depending on which scale you use. So if you improve sleep, you do get improvements in anxiety and depression. And often, again, it's something that people are more willing to talk about and work on than maybe depression and anxiety at first, until there's a bigger sense of trust built up. So, how are sleep and mental health intertwined? With depression, there's a long sleep latency. It takes a long time to get to sleep, but that sleep isn't deep because there's too much REM sleep. There's less slow wave sleep, more REM, so it feels more restless. And the cortisol doesn't wake you up in the morning. So you often are fatigued, but you're not sleepy. And that's an important distinction. Sleepy is when you feel your eyes like, I can't focus anymore, my body is ready for sleep. Fatigued is when you can just be tired, emotionally over it, not ready to interact with the world. So it's complicated because students might be trying to go to bed when they're fatigued, but without the sleepy. And if you're not going to bed with sleepiness, that can lead to a bigger sense of insomnia, because your body isn't ready for sleep, but you feel exhausted, deep soul exhaustion. Antidepressants decrease REM sleep, which is actually probably a good thing because there's too much REM sleep. With anxiety, you've got a long sleep latency with a very active mind, light sleep, frequent awakenings, often with nightmares and tiredness. Problem is, a lot of the medications to increase drowsiness, especially if they're GABA agonists, are going to decrease REM sleep, which is problematic because then you get the REM rebound. So here, the best treatment for insomnia is CBTI, cognitive behavioral therapy for insomnia. We want to teach sleep skills, not pills, for better long-term treatment of insomnia. And a behavioral sleep medicine practitioner is the person to seek out for CBTI training. Online CBTI training works just great too. With ADHD, there's problems with time management that makes keeping bedtime schedule challenging. This is one of my favorite studies to share. Half of children's ADHD diagnoses are resolved with treatment for sleep disorders. So that's only for students or children in this case who have both sleep disorders and ADHD. But if you treat the sleep disorder, half the ADHD is resolved without any further treatment. Sleep deprivation makes attention problems worse, but medicated ADHD students still sleep better than unmedicated ones, primarily because of increases in functionality and just getting stuff done. But again, the timing of that stimulant medication is really important. So I just wanted to do a quick head-to-head comparison from this ACHA database of students, like time they felt anxiety, hopeless, so depressed it was difficult to function. So here, higher numbers are more recent. And what I'm comparing that to is, how many days a week are you getting enough sleep that you feel rested? And I want you to answer that so. For me this week, it's maybe one day this week I've gotten enough sleep to feel rested, which isn't normal for me. How many days have you done strict training and cardiovascular exercise? I feel like we're often like, get more exercise. And I don't want to poo-poo exercise. But in college students, for both strength training and cardiovascular exercise, it's not really associated with decreases in anxiety. After you maybe have 1 or 2 days of exercise a week, you're not getting additional mental health benefit. Compare that to every single day, you get better sleep, you have significantly lower anxiety. Every single day a week, you get enough sleep to feel rested, lower anxiety. So it's one of the most powerful sort of treatments out there. We just had to get students to sort of buy into that. Same trend with hopelessness, some improvements a couple times a week, but every single day with better sleep, lower levels of hopelessness. Same thing with so depressed, it's difficult to function, right? So sleep really is protective, modifiable behavior that supports mental health. This is a study we did. Parker was a college student when he did that. He's a psychiatry resident now. Sleep quality mediates the relationship between traumatic events, psychological distress, and suicidality in undergraduates. So here, this is just a good way to illustrate the math. This isn't the way we mathematically did it. It was through structural equation modeling. But I'm just showing this as bar charts because I feel like it's easier to understand this way. This is suicidal behaviors here, self-harm, suicidal ideation, attempted suicide in 4 groups of students. Students who have neither sleep disturbance nor depression, sleep disturbance without depression, and the 3rd row depression, and the 4th row, both depression with sleep disturbance. And what you see is basically whether you have depression or not, having the sleep disturbance add-on sort of doubles or triples the risk of self-harm behaviors, suicidal attempts. So here we're thinking of good sleep as protective against suicidality, and that's true even as traumatic events pile on. For the students experiencing trauma, if they can figure out a way to get supported sleep, that reduces suicidality. Ooh, so I got 9 minutes left, and I think this is an important point. To sleep well, one must feel physically and psychologically safe. So who isn't sleeping well in college? So here I'll save you a lot of the math, but we did a reduction of all the sleep variables in this data set to basically say who is excessively sleepy. And this is kind of comparison of Z-score. So this is the average. People below here are getting better or lower than average sleepiness. Over here, much more sleepiness problems. So people with chronic illness, with psychiatric disorders, students who are gender or sexual minorities, who are racial and ethnic minorities, have worse sleep than straight white male student athletes. All right. This doesn't reflect the intersectional analysis, but know if you have multiple marginalized identities, that compounds with more sleep problems. Same with sleep timing and maintenance problems. So having trouble getting to sleep when you want to get to sleep. Again, if you are gender, sexual minority student with a learning disability, with a psychiatric diagnosis, that is really impacting your sleep. And that's going to be due to a lot of different factors. And I want to make sure we're really thinking about this from the socio-ecological model. That is not only going to be biology, individual factors, family, but also sort of beliefs about sleep health by different cultures and broader things like where are you sleeping? Are you having higher exposure to light and noise? So in Twin Cities, our Section 8 housing is by loud freeways. It's by manufacturing corridors. So it's where there's kind of greater exposure to toxins with less neighborhood cohesion and safety. And thinking about that on college campuses, where do people get their sleep? So I think it's important to ask again, what's upstream of these sleep problems? And structural equation modeling has helped us be able to answer that mathematically. Probably not a reminder, not a needed reminder to this audience, but just trauma. Trauma is one of the biggest predictors of poor sleep. I'll read this quote. It damages the nervous system, hijacks digestive tract, keeps the person in a constant loop of hypervigilance. And that's one where it's harder to sleep in a state of hypervigilance. So when we think about in students, what is impacting sleep, and I'm getting sad here just thinking about what's coming down the pipeline. Okay. We looked at during the COVID-19 pandemic in the first wave where there was a big increase in anti-Asian crimes and discrimination. For Asian college students, we had the impact of discrimination massively increasing rates of suicidality compared to 2019. So for 2020, the start of the COVID epidemic and the anti-Asian increase in hate crimes, we found a big mathematical increase in how much discrimination fed into suicidality. Well rested, however, was one of the protective effects against psychological distress. Right. So being well rested, protected, having insomnia, increased psychological distress. Food insecurity, loneliness, depression, the usual drivers, but discrimination really amped up that suicidality. Again, I mentioned Trisha Hershey at the beginning. If you're joining us late, I want to shout out again the really important work that she's doing, and recommend that you read her, listen to her work. I have also worked a lot with students with gender and sexuality minority students and how that impacts sleep. Compared to heterosexual students, gay, bisexual students have lower rates of prioritizing sleep in their schedule, higher rates of awakening with an anxiety, higher rates of being restless. And a lot of that is impacted by where they're living on campus. So Abby Heller did a lot of this work. They're in grad school now. They're an RA at our campus and sort of witness firsthand how hard it is for gender diverse students to function in a campus that's set up in a binary, in a gender binary. And so we analyzed for cisgender women, cisgender men, trans women, genderqueer individuals, and found that there are massive differences in what they're experiencing in terms of stalking, safety, fights, sexual aggression. And importantly, that is modified by where they're living. Students on campus who were not cisgender male had higher rates of not feeling safe and experiencing violence, right? So basically, on-campus housing made it better for cisgender men, made it worse for everybody else, and living off campus was actually seen as safer. So predictors of poor sleep in queer students, not surprisingly, and I think I want to sort of end it in a couple slides here, but mental health concerns, financial concerns, partner violence were major predictors of poor sleep, even when we kind of looked at it by different sexualities. Lesbian gay students in particular have partner violence problems impacting sleep. So it's kind of really important to disaggregate this data. I know I'm rushing. Oh, sexual assault is bad as well, not surprisingly. So what can we do to increase how we promote sleep health, and how can we think about ways to think about what is residence life doing, what is athletics, what is counseling, how are we assessing sleep, talking about sleep, accommodating for sleep disorders, providing facilities with like blackout curtains, making sure the places that we are sleeping are cool enough temperature wise, are quiet enough, are safe enough to sleep. So that, I know we just have 2 minutes left, and I want to save time for questions, but the take home messages here: sleep is a powerful predictor for well-being and retention. And if you have institutional data from ACHA, I encourage you to disaggregate by different group and look at sleep. Sleep health is a complex factor that includes timing, regularity, and satisfaction. Sleep health disparities reflect social inequities, and my deep fear is that this is just going to get worse in these coming years. And that institutional sleep health change can be done, but it needs to be collaborative conversation with a lot of key players. So I am going to stop share and look at for questions and chats. Ooh, is it possible to change circadian rhythms when melatonin is released? Not really. You can shift it a little bit, and I definitely recommend, if you're a night owl trying to have an earlier schedule, melatonin in the evening in the dark, because it's disactivated by light, can help. It's important for sort of changing what schedule you're on, but if you're a night person, you're going to stay a night person. And the best thing to do is avoid bright light at night and try to get that bright light first thing in your morning, whenever that is. Oh, thank you for this comments. I appreciate it. And take care of yourselves and your sleep, right? Because it's hard to be fully there and show up for our students when we ourselves are not getting good sleep.
Absolutely. Well, we are coming up against time here at 1 o'clock. I just want to say thank you again so much, Dr. Prichard, for sharing your expertise today, and wishing you all good sleep and sweet dreams as well in the coming months. So thank you again. As a reminder, the code for today's session is 16 Gs. That's 16 GEES. Feel free to reach out at opcsmh@neomed.edu if you have any questions. And thank you again, Dr. Prichard, and everyone for joining us.